You know how some people use condoms and take pills to double pregnancy prevention efforts? What if you could do the same thing, wear condoms and take a pill to up the prevention of HIV transmission? PrEP. It's a pill that stands for pre-exposure prophylaxis, and it prevents HIV. It works to stop any invading HIV virus from setting up shop in a new host. HIV, PrEP. The drugs in PrEP called and both inhibit the replication of HIV in the body if it is in the body. Whoa. When I first started doing HIV prevention work in the early 2000s, PrEP wasn't around. We did have PEP though, post-exposure prophylaxis. So if I were to get stuck by the needle I had just used to test someone's HIV status, I could go to the health department within 72 hours and get a medication that would prevent HIV from establishing itself in my system. That was PEP. PrEP is the preemptive version, as in, I'm gonna prevent the attack rather than intervene on it. Here's the thing though, PrEP isn't a one-time dose or an as-needed medication like take it Saturday because we're having sex on Sunday. For it to work, it needs to be built up in the bloodstream so that if HIV were to enter here, PrEP would be on site to be like, here's one person's thoughts on it. As a receptive partner, I had always made my HIV status contingent on the top using a condom, making sure it didn't fall off, fall in, or break. With PrEP, I could make rational decisions about my sexual choices and still remain 100% in control of my negative HIV status. That has increased my romantic and sexual connections greatly. Well, maybe not 100%, but it is 90% effective at preventing HIV transmission, and that's incredible, especially when paired with other methods like in and out condoms. Let's do the math. I take PrEP consistently and use condoms properly, and my risk of becoming HIV positive from penetrative sex with someone who is HIV positive is less than 2%. And with perfect use of these methods, it's less than 0.02%. That's arguably a game changer where virus loses and humans win. There are approximately 2 million new HIV infections per year. With PrEP, that could be a difference between this many people becoming HIV positive and passing the virus to this many people, and then this many people becoming positive and passing it to this many people. There are communities who function in a when I get HIV, not if I get HIV mentality. There are people who fall in love with someone who has HIV and want the intimate experience of sex with that person without such a high risk of becoming HIV positive too. Others just want to have sex. They want to do it and do it and do it. In these riskier situations, PrEP can decrease sex suck. We're a problem-solving species. We figured out how to control parenthood with the pill in the 60s, how to avoid 70% of cervical cancers with Gardasil in 2006, and now how to impede HIV transmission with PrEP. Why aren't we all taking it? Well, to start, not everyone needs it. If you're not at risk for HIV infection, there's no sense putting a medication in your body that comes with side effects, a strict regime, and a hefty price tag. Plus, if the person taking the medication is unable to strictly adhere to when and how it needs to be taken, it may reduce the efficacy of the drug. Another biggie is social stigma, but bleh. People shame PrEP like it's a path to promiscuity, but promiscuity is a term designed to control other sexualities. Just as access to condoms, birth control, and sex education don't cause people to be sexual, neither does PrEP. People are sexual, so who should take it? People who are HIV negative, meaning they don't have it, people who have done their research, talked to other healthcare providers, people who can ask for help, follow directions, and use condoms. It is the most practical for people who want to partner sexually with people who are HIV positive or HIV uncertain and don't want to become infected. Take it or leave it, at least stay curious. PrEP is one way to reduce the risk of HIV transmission. Here are some others: getting tested, sharing your results, wearing condoms, low and no risk behaviors like oral sex and dry humping, and making out too. Pow, pow, pow.